Welcome once again to another edition of the Expansion Zone with Sonia Barrett. Of course, I am your host, Sonia Barrett. And as always, thank you for tuning in. And I am always wishing you an enlightening Monday. I am a tad bit hoarse, coming back from the yearly retreat. This year we had it in Utah, and of course visiting Zion National Park, which is just amazing. It's always just so breathtaking, just going through all of those areas to see nature at work for millions of years, or who knows exactly how long. But anyway, so that's why my voice sounds a little bit off today. And as usual, I want to do a quick quote. This time the quote is just, "A healthy outside starts from the inside." This one is simple. It's by Robert Urich. Sounds so simple, but incredibly significant. So today's topic is, we're going to talk about neurofeedback, basically optimizing brain function. I love the latest technology. I like things that are there that allow us to really better handle ourselves. And we are certainly in an age where we are being sort of pushed towards more self-reliant protocols, tools, looking to see what's out there so that we can better care for ourselves. And the guest that's going to be sharing with us today is Gregory L. Gillespie, founder of Neurogen. So I'm going to read a bit of his bio here. Master Gunnery Sergeant Gregory L. Gillespie retired after a distinguished 30-year career in the Marine Corps. The majority of Greg's career was spent in the Marines, most elite units, Reconnaissance Battalions, Force Reconnaissance Companies, and other special operations forces to include Naval Special Warfare Command. He was deployed overseas 10 times with 7 combat developments in the Middle East. In 2007, Greg retired with multiple concussions, blast injuries, a traumatic brain injury, and severe PTSD symptoms, 5 years of traditional medical treatments, and countless prescriptions were of little help. And he continued to struggle with chronic pain and many PTSD symptoms, including debilitating migraines. So in 2012, Greg volunteered to be patient zero in a brain study utilizing Neurogen HPN technology. Inspired by his own phenomenal response, Greg dedicated himself to bringing Neurogen HPN's life-changing technology to his fellow veterans. So in 2018, Greg co-founded Neurogen Brain Balancing with the express goal of helping combat veterans who have PTSD for free. So Greg Gillespie, welcome to the Expansion Zone.
Thank you, Sonia. It's a pleasure to be here today.
Yes, good to have you here. I was so delighted when I met you, it's one of those things, you know, how things sort of line up. I was there at Cocoon Spa for the water, and, you know, there you were. So nothing is by chance. So here we are. Now, let's just dive into, I think, first of all, what is Neurogen? And I guess we start from the concept of neurofeedback. However you want to give just a brief explanation so that we can then dive deeper into it.
Okay, so Neurogen Brain Balancing, that's our company, and we use the Neurogen HPN, which is high performance neurofeedback system. So we like to call it passive neurofeedback. And when we say passive, we mean that the client or the patient just has to sit in a chair and we hook the system up to their scalp. They don't have to watch a computer screen or listen to sounds or have any type of stimulation to the body. They literally just passively sit in a chair, and the system diagnoses the malfunctions, if you will, of the brain. It's looking at your brain waves, and your EEGs and your frequency spectrums, and it sends very small electrical impulses into the brain, and your brain will do something in response to that input, and then the computer adjusts itself based off of what your brain is doing. So we are optimizing your brain function. So that's kind of it in a nutshell.
So, okay, so when we say optimizing brain function, let's say, is there a difference then? Because this is going to come up, because I mentioned it to someone before and they immediately said biofeedback. And I think that maybe if you can explain the difference between the two so that, you know, people aren't confused as to.
So neurofeedback, biofeedback has been around since the early to mid 1960s. And of course, with any technology, as time goes by, it gets better and more effective. So I use the term passive neurofeedback. Biofeedback, traditional neurofeedback, the patient that's receiving the treatment, they have to actively participate in the treatment, and that they have to watch a computer screen, or they have to listen to sounds, or there is some type of device that is giving them the stimulation to their skin that they have to react to. And they're basically, what they're trying to do is change a person's behavior. And if you don't pay attention to the screen, let's say you had a severe case of ADD or ADHD, or you had very poor vision, or you had very poor hearing, you wouldn't really be able to respond to what's happening on the computer screen. So with our system, each and every treatment is different than every other treatment, because your brain is constantly changing and our system changes in real time. And I think that's why our system is so effective, in that if we gave you a treatment yesterday and then we gave you a treatment today, even if we gave you the exact same treatment, it would be a completely different treatment, because your brain is different today than it was yesterday.
Yes, I thought it was really important that I asked that question, just because the immediate association is with biofeedback. And so also, from what you're saying, we are optimizing the brain. So is this a cumulative experience? You know, the brain is literally being enhanced. Is that the word, should I say? Enhanced or adjusted? Is there a difference between the two words?
Well, I wouldn't really say enhanced. I mean, the individuals, let's say you were an athlete, yes, your performance could be enhanced.
But not the brain.
We're not necessarily enhancing the brain. We're making your brain work at its highest level. So if your brain is not working very well, say you have poor brain function, we can get your brain to where it's working good. And I know that's not correct English, but we can take you from poor to good. And if you're functioning at the good level, we can take you to a much better level. And if you're functioning at a really high level, we can even tune that up to a higher level. So we're not enhancing the brain, but we're enhancing the brain function.
Okay, I see what you're saying. Well, I think that part is extremely important, because here you're saying you're not enhancing, but you are allowing the brain then to operate at every next level of optimum then ability.
Yes, everybody's brain wants to work at its most optimal level. No, I don't think anybody's brain wants to work poorly, but a lot of times we don't have that choice. People have concussive events. Maybe they're in a car accident or a work-related accident, or people are physically abused. And there are other people that have horrible sleep deprivation, or they're eating an incredibly poor diet, or they're ingesting opioids or alcohol or, nicotine into their body. And all these things help to damage the brain. So we help to bring the brain function back to prior to those things damaging the brain.
Mm-hmm. And so when you're saying that, I'm looking at, geez, everybody's pretty much been traumatized in some way. There's like trauma, stress is very traumatic on the brain. So in this time, what we're seeing is probably a lot more people. I don't know if that's reflective in terms of what you've seen with people being under so much stress. I mean, do you see a lot of that? Because you can look at somebody's brain and you realize that it's not, it's operating in a pretty, I'm going to use the word good again, balance, maybe considering what they're going through. I mean, do you see anything of today's world that seem to increase numbers in terms of people's optimum brain function?
Well, Sonia, the thing I think we're seeing more over the last year to year and a half is the term COVID long haul.
Mhm.
So we are seeing many, many more people that have contracted COVID. They've lost their sense of smell. They've lost their sense of, they just have a general feeling of malaise. And so, yes, we're seeing a lot more of that. But when we hook them up to the system, the vast majority of them, the brain fog is lifting. So they're getting clarity of thought, their cognitive function is increasing, they're sleeping better. And in most cases, they regain their sense of smell and taste. So we're seeing a lot more of that than, what we saw, say, a year and a half ago. But Neurogen brain balancing, we started off focusing on combat veterans or veterans in general. So we're seeing PTSD and traumatic brain injuries. That was always our bread and butter. So, and that's kind of our baseline of who we deal with. So I can't say that we're seeing worse brains than we did before. We're just seeing more brains than we did before.
Right. Yeah, I was curious about that as to just looking at the overall picture, because when someone has, for example, when you use the machine on me, I remember there was, I think, the left side of my brain that was probably not functioning as optimally as the other side. Now, we don't know that. I didn't know that. What I did know is that I noticed my right eye was a bit more blurry for the last couple of weeks. And so I thought, well, maybe obviously the left controls the right. So I wondered about that. I just know the next day after the treatment, my eyes, it was clearer. So that's what I'm kind of looking at. Can you speak to any of that?
Well, as you know, different parts of the brain control different functions of the body. So in your case, with your vision, when I worked on your occipital nerves, the back part of your brain, you probably did have and probably do have 20/20 vision. So your eyeball is working the way it's supposed to, but from your eyeball to the occipital portion of your brain, there was some interference. And so I was able to go in there and clear that up. And then, within a matter of hours, you were able to notice that your vision was markedly improved.
And you also said that you may get sleepy, feel a little bit, whatever, tired or want to go to sleep later on in the afternoon. And it was kind of funny because, I was with two other people, and I remember they had contacted me via text and said, oh man, we were knocked out. And I thought, oh no, I said, I've been fine. And it was shortly after, then suddenly, I was in my brain, it put me to sleep. Suddenly I fell asleep. I was out because I'm not a napper. So I saw those things that you were indicating may happen. And then the next day, of course, when I woke up, then I saw those changes. But would you say that anybody at all really should probably maybe just even get one treatment, simply because in my case, I didn't know that that is what was going on? Would you say this is for anybody at all, regardless of the intensity of something they might be experiencing?
Yes, absolutely. So when people go to our website, or they meet one of the practitioners, or they see some of our brochures, they see all the many different things that we can help with. And I think we list probably 40 different things. But people will come to us and they'll say, hey, my mom has this, or my nephew has this problem. Could your system help? The answer is yes, it could absolutely help. And I've gotten to the point where I jokingly say that how you can tell if the system is going to help somebody, there's two criteria. If the person has a brain in their skull, and if they'll sit in the chair, they're going to benefit from the treatment. I don't care who you are, or what your problem is, or what problem you don't have. Everybody can benefit from a higher, more optimally functioning brain.
Now, also, I remember talking to you about this, at least you were sharing this with us. If somebody has Alzheimer's, you explained at the time that you can, it's like you, in a way, put a pause. You can't go back in fixing, but it's like you stop it from progressing. In case I'm saying this incorrectly, yeah, can we talk about that?
Yes, absolutely. So our experience is that we definitely slow down the progression of the Alzheimer's and dementia. And I would even go out on a limb and say we've probably stopped the progression in many cases. So an example of how we come to notice that, many Alzheimer's and dementia patients get placed into a full-time home type environment where they have professionals that take care of them 24 hours a day. But there are a lot of people that can't afford to put grandmother or granddad or mom or dad into a facility. And so they home care for the Alzheimer's person. When the Alzheimer's first sets in, the person that has the Alzheimer's can dress themselves, they can feed themselves, they can go to the bathroom by themselves. So their physical function is there, but their brain is slipping. So the person may be fixated on orange juice as an example. Their conversation just continually rotates around, they want to drink orange juice. Okay, if you're taking care of that person, it's beneficial to have them dress themselves and feed themselves and go to the bathroom by themselves. Eventually, as the Alzheimer's progresses, the people will not be able to dress themselves. They won't be able to feed themselves, and you're going to have to go wipe them after they go to the bathroom. If we do the Neurogen brain balancing treatments on them, we keep them to the point where they can feed themselves, dress themselves, and go to the bathroom. That's huge. I would rather have somebody in that state that still talks about orange juice continually. So,
yeah,
makes sense. That's huge.
Yeah, I think that's absolutely huge. And I wanted to bring that up because it seems like we're hearing about this so much more, Alzheimer's. I mean, I think years back, I don't know if it was as prevalent. I don't know. I just know our society has changed for a lot of different reasons. We see a lot of different diseases and so on. But I think that's a big one for a lot of people. If you can stop it there, at least that person also still has some dignity. They still have some of that left, as opposed to the complete, deterioration. And how about people with Parkinson's? What have you seen with that?
So the people with Parkinson's, once they've been diagnosed and they come to us, they almost always have the tremors in the hands and in the arms. A lot of times their head will shake. And I would say we're in the high 90 percentile for making the tremors and the shaking go away. Most of those people also have high anxiety because they're fearful of what is going to happen to them as the disease progresses. So we definitely can knock the anxiety down, or in many cases make it pretty much go away. So I would have to say every Parkinson's person I know that I've personally treated, and I know that our practitioners treat, we have a huge success rate. They're very happy with the results that we achieve.
Mm-hmm. So the tremor, which is a big part of this for many people, the tremor is drastically reduced, or in some cases, maybe completely stopped.
Yes, that's correct.
Oh, wow. That to me is huge, because I've known people with it, like my my ex-father-in-law, and that was a big thing to him, is being able to slow that down. And I want to point out to folks too that, you know, in his case, it's taking the medication that he didn't like the way it made him feel. So to be able to get something like this that's non-invasive and, you know, reduces the possibility of having to take a medication to reduce the tremor. Am I saying that correctly in that sense? If the tremor is reduced, have you heard or noticed that those clients then don't need that particular medication most times for the tremor, if the tremor has stopped? I don't know what else they have to take, but in terms of that.
Well, so we don't do medical advice. So
right.
We tell the patient to confer with their medical professional. But as in the case with the tremors and just about any other problem that medication is prescribed, when we make the brain work at a more optimal level, that makes the drugs more effective. So if the drug is more effective, you probably don't need to take the same quantity of drug that you were initially taking. So in cooperation with the medical professional, they can decide to titrate down to a lower prescription or a lower dosage. And we see that quite frequently. Mm-hmm. In some cases, the people get completely off of the pharmaceuticals.
Right. But I understand what you're saying. Their doctor is going to help them to determine if they can go ahead and do that. Just making sure that folks understand that. And of course, you know, you're knowing based on, you know, the outcome. There's also something else you talk about. And I think after the break, we're going to go to break in a little bit, then we can probably move into the area of the demonstration. But one of the things that you had mentioned to us were cases where, as long as there was brain function for certain people that have been in comas, but there was brain function, that this technology was able to wake them up. Can you talk about that?
Yes, there's been several cases where we've been invited into the intensive care unit by the attending doctors. They've had a person that was in a coma, and the person was in a coma for a number of days. And the one that jumps out at me, that they'd been in a coma for 19 days. And so I came in on day 19 and we did the initial brain balancing treatment on the coma victim. So the treatment that we did is the typical very first treatment we do on every new client. So I did the treatment on the lady. That took about 25 minutes to do the treatment because she was laying in bed and we had to lift her head to attach the electrical leads. After the treatment, approximately an hour later, she came completely out of the coma. She had full vision, full hearing, full ability to talk. She had regained full use of the arms and legs. So it was almost as if we had jump-started her brain.
That's so fascinating. That is so fascinating. And the treatments typically are how long? You said 25 minutes for her, but what typically how long?
If it's a person's first time treatment, we schedule them for an hour. The actual treatment takes about 20 to 25 minutes on a first treatment. And that's because the person getting the treatment has a lot of questions. And typically they want to see the computer and see what their brain looks like on the computer. They want to see the EEGs. They want to see their brain waves. They want to see the frequency spectrum. It's all very exciting to them. So that first treatment, the treatment itself takes about 25 minutes. When you come for a subsequent treatment, and it depends on your hair length and your hair type and what your particular treatment is going to be, it's usually from the time you sit in the chair till you're out of the chair is less than 20 minutes.
Okay. Yeah. All right. Great. Well, here's what we're going to do. I am excited to continue this conversation and to see this example or the sampling of what that looks like. You are listening to The Expansion Zone with Sonia Barrett. That's me, of course. And my guest today is Gregory Gillespie. And we are so excited to be talking about this amazing interface system that is the brain. You don't have a brain, I mean, it's all over. So as he says, as long as you have a brain and you can sit in a chair, you can have this very cutting edge experience. And, it works on migraines. There's so many people with migraines and depression and fibromyalgia. I mean, it's all of these things. So, Greg, we can lead right into that. And then, you can talk a bit more even for those people with fibromyalgia and pain and so on. So I'll let you lead the way.
Okay, Sonia, so while I'm talking, the people on the radio can't see it, but the people that will be able to see the podcast, to the left of me, we have Don is sitting in the chair, and behind Don is Ann Morgan. And Ann Morgan is scrubbing Don's skin at the locations where she's going to put the electrical leads. And so how this works is we have 5 electrical leads or wires. We have a ground wire that goes on the back of the neck, and behind each ear on the bony part of the skull, which is the mascoid process, we put a negative wire. And then we have 2 positive wires that we move around to different parts of the brain. That's how we can look at the different parts of the brain. So we're completing 2 electrical circuits on the head. And typically one of the circuits will be on the right hemisphere of the brain, and the other circuit would then be on the left hemisphere. And the computer can read what's going on in the 2 hemispheres, and it can compare them. And frequently we will find an imbalance in the brain. So in your case, the right side of your brain was working better than the left side of your brain was. And the computer instantly figured that out, and it changed the electrical impulses. And that caused the left side of your brain to try to come up and match the right-hand side. So we call that balancing. Now, in reference to your question about fibromyalgia and migraines, this treatment is very, very successful. For migraines, it's typically no more than 2 or 3 treatments, and the people have no more migraines, period. And we've, well, I'm a classic example. So I'm 9 years, coming up on 10 years without a single migraine headache since I had my migraine treatment. And that's fairly typical of what we're seeing. For fibromyalgia sufferers, they have pain in almost every fiber of their body, and it's 24 hours a day. We do the first treatment on them, and they will get out of the chair and they're amazed that the pain has subsided. They're very excited, and rightfully so. The question is, how long will they remain pain-free? Everybody's brain is different. So a typical person may go 7 to 10 days without any fibromyalgia pain. Unfortunately, they'll wake up on day 9 or 10 or 11, and they'll realize that the pain is starting to come back into their body. If they come back and get a subsequent treatment, they'll get out of the chair and the pain will be gone again. And typically the duration will double or triple. So now they're going 21 days to 27 days without pain. The pain will come back. We do another treatment, and now the duration doubles again. So they're going a month and a half to 2 months without pain. Eventually, their brain will hold that balance and they will not need to get follow-on treatments at some point.
I love that. Yes, that's what I was wondering. If over time, it's because it in a way, I guess, yeah, you're sort of reprogramming. I don't know if those are terms I can use that are appropriate, but reprogramming or remapping, and it records it. And now that's normal. It becomes the normal way of functioning.
We call it rebooting. So and I know this is very simplistic, but if you think of your brain like a laptop computer or a personal computer, sometimes your computer just slows down to the point where it's just not functioning well. And so a lot of times, without calling tech support, how do we fix our computer? Well, we reboot, and all of a sudden the computer's working the way it's supposed to.
Makes perfect sense.
That's what we're doing with the brain. We're rebooting it back to its original default setting.
I love it. That makes perfect sense. Perfect sense. Okay, so I'll let you go ahead and continue the process here.
Okay, so Ann Morgan has hooked up the 5 wires to Don's scalp. So behind the neck, we have the ground wire, and behind each ear, we have the negative wire. Those 3 wires remain in place for the entire treatment. And then you can see up here on the front of Don's forehead we call this site F3 and F4. And Morgan is looking at Don's brain. And unfortunately, our laptop is behind Don. You can't see it. But Ann Morgan is actually looking at Don's electroencephalograph, and she's looking at 6 of his 7 brain waves, and she's looking at his frequency spectrum. So she's watching the signal go from his brain down the brain stem to the spinal cord. And then that goes out to every organ in the body. So while she is mapping his brain, more importantly, the computer is comparing the performance of the 2 hemispheres. And if one side is working better than the other, then the computer will stimulate the side that's not working as well. And literally, Ann Morgan can see his brain shifting and changing. She'll see his brain waves change. She'll see his EEG normalize, and we'll see the signal get more coherent down through his body. Okay, so she's now moved the wires to a different part of his brain. So she's already accomplished her work at the frontal cortex of his brain. And now it was that quick, and now she's moved the wires to a different part of the brain. So there are 24 different areas on the brain that we put the wires. So if you had, let's say you had suffered a stroke, or you had a brain bleed, or some type of trauma to your brain, we can actually see on the computer screen that point in the brain where you've suffered the damage. Well, it's good to have that information, but more importantly, while we're looking and identifying the problem areas, we're actually helping to heal and fix that part of the brain while we're looking at it. So it's not just a diagnostic tool, it's also a corrective tool.
Oh, no, I was going to mention, because I hadn't mentioned that before, but when you mentioned stroke, and then I wondered how effective this is also for people who have had a stroke. And you know how that is when somebody has a stroke. For some people, they may be more affected with one side of the body, leg dragging, or all these different effects from that kind of disconnect in the brain.
Yes, so we've treated hundreds of stroke victims, and we see everything from the people that are at home laying in bed. Their stroke is so bad that they can't work their arm or their leg on one side of the body. They typically can't blink their eye, and the worst thing is they can't talk.
Mhm.
Okay, that would be a worst case stroke person. We see other stroke victims that can walk into the office and they're talking to you, and they'll sit in the chair. They just have some cognitive, dysfunction, and maybe their fingers don't quite work as well as they should, or they don't have the feeling in their fingers. That would be a mild case. We see everything in between. So typically the person that has a stroke will be in a wheelchair. They can't walk, they can't use one of the arms. And typically by the second or third treatment, they can now get up out of the wheelchair, and they will regain speech and use of the eye. That's typically the first thing that comes back. And as we progress with the treatments, they'll get out of the wheelchair, they'll start walking. Now, when they first start walking, they may have to use a walker, and then they transition to the cane, and then they go from the cane to using no type of device. And in almost every case, we get them back to where they're completely walking and talking, and they've regained full use of the arm and leg. So, I mean, that's quite noticeable.
Okay. So basically it's depending on the severity of that person's stroke, it's like you're starting off, and you get the brain to, at that time, I guess, the most optimum ability of the brain based on the damage. And then it just keeps building on it each time, even though it's rebooting, but each time it's building on being optimized to that
Correct.
point where people
Yes, so
eventually.
it's definitely cumulative. They can see from treatment to treatment their progression of getting better. And just from my personal perspective, I thought being wheelchair bound or being stuck in bed would be horrible, to be immobilized. In speaking with the stroke victims later on, the inability to communicate is the most aggravating thing to them. Once they get the ability to talk back, at that point, they know, hey, there's definitely light at the end of the tunnel, and we're going to get there.
Right.
When they cannot communicate with their caregivers, that is the thing that drives them crazy.
I would imagine so. I mean, I think the rest of us, we take it for granted because every day we get up and all these functions are there and they all work. But to not be able to communicate, which is, big for a human being, communication, I imagine that would definitely be frustrating. It's trying to figure that out. Now, as far as even depression, I want to look at that as well, because there's so many people that are suffering with depression, and maybe even, okay, I'm gonna break it down a bit. So there's depression. There are people who are bipolar, and what else is there? Manic, all of the postpartum depression. Yes, I did mark that down because that's a big one. Postpartum depression. What do you see of these people? I mean, in terms of coming out of this and feeling like, oh, finally, I don't feel like I'm losing my mind.
So what most of the people that suffer from depression, and you're absolutely right, I mean, we see a lot of people for depression. They usually the day after their first treatment and then after subsequent treatments, they kind of describe it as if a weight like a ton of weight has been lifted off of their shoulders. There's just this emotional release and lightness that kind of occurs. Now, when we first started doing this a few years back and we started treating people with depression, after the first 1 or 2 or maybe even 3 treatments, many of the people came back and they said, I'm crying. I feel like I have to cry. And at first we thought, oh, maybe this isn't good. We're, kind of triggering it. But in reality, it's like
it's a release.
It's a release. They're dumping this extra baggage at the Greyhound bus station. And when they come out the other side 2 or 3 days later, they feel light and airy, and there's a pep in their step. And all of this unwanted, unneeded, unnecessary baggage, they've released it, and they feel so much better. And it's the same thing with anxiety and stress. When we do those protocols on the people, they feel as if this tremendous burden has been lifted off of them, and they can see clearly and think clearly. And there's a purpose in life.
That part, I think, is big for a lot of people, because when many people, when they're going through depression or any of those mental health issues, purpose is something that they feel lost on, because you have no motivation, you have no momentum, and purpose becomes this very, very big thing. For those of us who aren't suffering from that, but you have friends, somebody always has a friend or family member that's going through this, and we can't imagine. If you've never experienced it, you can't imagine. And people with anxiety attack, there are people that trouble with that all the time, these anxiety attacks.
Yes, I would say probably 90% of the people that we see, when they come in, they typically have some malady that they want corrected. They have depression, or they have ADD or ADHD, or they've got brain fog from going through chemotherapy or radiation, whatnot. I would say that almost everybody has some degree of anxiety, whether they admit that or not, or whether they're aware of it. So when we do the anxiety protocol, which is very quick and very simple, everybody gets a positive response from the anxiety treatment. And at Neurogen Brain Balancing, our focus is on the veterans. If 100% of veterans have anxiety, many of them have post-traumatic stress. Some of them, if they have post-traumatic stress, they've got anxiety. That's not to say that everybody with anxiety has PTS, but 100% of the veterans, we treat them for that in addition to their other problems. And 100% of them respond very positively to the protocol.
Now, it's interesting because although we might not all be in a war, or perhaps living in a war-torn area where, you're dodging, bombs and trying to hide, I think it's really interesting how you can find people that you would think that they are in a war or war-torn area, and they're in PTSD based on their family lifestyles, family situations, abuse, so many things. I mean, you see what I'm saying, though. So PTSD, yes, for veterans, but then there are people that are actually experiencing life as if lions and tigers and bears are chasing them, or, a bomb's being thrown at them.
So we deal with a lot of emotional trauma with, adults. When we start digging a little deeper into what different protocols we're going to do on them, we come to find out they were sexually abused as children, and so they've been harboring that their whole lives. Well, that's traumatic to them. So that's a form of PTS. People that were come out of the foster home, program, all of those people have got some type of PTS, physical abuse. So while I would say post 9/11 with the veterans, PTS has become a buzzword. Well, okay, yes, the veterans do have it, but everybody else in society has it too. It's just not as highlighted. But I'm telling you that PTS is across the entire spectrum.
That exactly. And that's the point I was making. As they say, everybody's burden, is great to them, and how we're responding. And also we have a lot of people, or I should say, as human beings, we're really good at surviving. So we learn to bury things, but then they're affecting us in different ways. So I also want to ask you now, is there anyone that this doesn't work for, or they shouldn't do it? I'm asking because there's always somebody out there that has a question like that. I've got a pacemaker, I've got, heart issues, just to clarify that.
No, so if you have a pacemaker, you're fine to do this. If you have cochlear implants, you're fine. If you have metal plates in your head, you're fine. There is no person that would have any type of device in their body that would not be a candidate to get the neurofeedback treatment. And we have treated as young as a 5-day-old infant, and we've treated people that are over 100 years old, and the whole spectrum in between. Now, we have had a very, very small percentage, I would say less than 5% of people that have had a treatment, and then their feelings afterward was, this did absolutely nothing for me. There was no benefit whatsoever, and I'm not going to do this again.
It's a small number.
Very, very small number. And the case with those people, we did no harm and we didn't make them worse. They just didn't see any benefit. And so they choose not to do follow-on treatments. There are a large number of people that see such a huge response after the first treatment. I'll say migraine sufferers as an example. On the first treatment, we take care of their migraines, and they don't need a second treatment because we took care of the migraines. So those people are one and done. Most people will need a series of treatments. They didn't get the way they are overnight, and we're not going to be able to fix them overnight. But 95% of the people see a positive to a very positive response to the treatment.
Now, I want to address the simplicity of what we just experienced, what we just witnessed with the treatment. But I also want to say real quickly too, that my friend had gone to Greg because she had come down with Bell's palsy, and and I saw her a few days later, a couple of days after she had been to you, and she was telling me, because I could see a difference in her face. I didn't see it at its most extreme, but I could see that. And she said that by the very next day, that side of her face, her eye was clearer, her function was clear, was better. And so she was extremely excited. And over the course of those couple of days, we witnessed her face pretty much normalizing. It was just a little bit, but you have to really look carefully to see that. And so we saw that. So I have seen this myself with someone that I know. So I just wanted to throw that out there. Now, also the simplicity of the treatment. We're looking on, and he's sitting, he was very relaxed. There's nothing, no tension, nothing to be tense about. And he's vastly improved. He was crazy before he sat down, but now he's just a little crazy.
So Sonia, one thing I would like just to point out to you and yourself and the viewers. So Don is a trained practitioner, and Don is an animal behaviorist. And Don is also doing neurofeedback on dogs.
Ah,
and he is getting fabulous results on dogs. So
mm,
the system not only works on human beings, but it also works on dogs and horses.
that is good to know. That's good to know because certainly, we've all had dogs and, for forever, human beings always have their dog. But I feel like we live in a time now where dogs are certainly much more highlighted and are companions to people for so many different things. And so I do feel that they take on stress. They take on the stress of the people that they are there to help. And I think we really need to look at that as well. They take on a lot. Animals are taking on a lot from human beings. So that is good to hear.
So Sonia, while we were talking, and if you weren't paying attention, you would have missed it, but Ann Morgan did a treatment on Don's brain. So what the people that can see the podcast, what they see, that is a typical treatment. You sit in the chair. If Don wanted to read a magazine or do texts or look at a laptop, he would have been able to do that. That would not have affected the treatment, and the treatment wouldn't affect his attention span on something else. But you saw how simple it was.
Yes.
He was sitting in the chair. Ann Morgan moved the wires to the different parts of his brain. She watched the computer and saw how his brain was responding, and then she knew when to move the wires. And in less than 15 minutes, she had done his entire brain.
I love it. That's what I'm talking about. That's where we are. Star Trek stuff. I love it. Now we're there. We have about maybe a minute and a half. Is there anything else that you'd really like people to know? How can they find you, your website? How can you make an appointment? Any of that?
They can go to a search engine and look up Neurogen brain balancing, or they can go to Neurogen BB, which stands for brainbalancing.com, and they will be able to find out all the information about the system, how we do the treatments, and they could even book an appointment there. So that would be the easiest way.
And the information will also be on the expansionzone.com website under his profile. So you click on it, and whatever you miss, we'll have the links there, because we want to see you well. We want you to have these options.
Sonia, one thing I'd like to add, everything we've talked about up till now is we've talked about the brain. Well, several years ago, we started using the system on body parts. So people that have torn meniscus in their knee, or mostly lower back pain and shoulders. And the system is phenomenal at alleviating the actual body pain. So we can definitely help the brain, but we also can make pain go away from the body.
That's good to know. The pain thing is something that many people are dealing with. And I guess I could have thrown this in for a quick second. In arthritis, I mean, does that all go in the same, care? Is there anything that comes from that? Or is it really just pain reduction, maybe? Because it's inflammation. So.
Right. So when we're talking torn ligaments or tendons and muscles, highly effective. For the inflammation of the arthritis, we can make it better, but we can't make the arthritis go away. So there will always be some residual pain there.
Gotcha.
This is very effective on addiction as well. So people that are in pain, a lot of times they get addicted to the opioids. So we can break that addiction cycle. In addition to taking the pain out of the body, we can get you off the opioids.
Wow, that's big. And it just came right at the end of all of this. Well, I want to thank you all so much for joining us today, for having been on the Expansion Zone. And I'd like to thank the audience as well for tuning in. Do check out the expansionzone.com for all the information. Anything that you may have missed, you can hear this show again, along with all the other shows in the archive, theexpansionzone.com. And to find out more about me, do visit therealsoniabarrett.com. Thank you to the listening audience. And as always, I like to remind you to live life to its fullest and question everything. Until next time, see you then.